Hello viewers, welcome to today's town hall. With us we have Dr. P.K. Hazra. Dr. P.K. Hazra is a consultant interventional cardiologist and also H.O.D of cardiology and director Cathlab at AMRI Hospital, Kolkata. Dr. Hazra will be addressing commonly asked questions about blood pressure in today's session. So Dr. Hazra, would you like to add something to this?
Yeah, I'm Dr. Hazra, and welcome. And today's session, I'll try to make it very interesting, very simple, and entertaining for everybody. So I will talk very hi-fi thing, and you can forward some questions to me, and I'll be able to answer in a short format and communicable, simplistic way. Thanks for joining us.
Thank you, Doctor. Thank you. Great to have you on this town hall session. We move on to the questions, Doctor. What causes high blood pressure or hypertension?
Hypertension in cardiology is basically a number, 3 digits number on the higher side and 2 digits number on the lower side. Now, this is a force generated by heart on the tubes which are connected to the main pumping organ of any mammals, any human body. So basically, it's a force, and this force is translated into a number, and that is measured by a mercury. So there's 120 by 80, and when it is normalized to atmospheric pressure, or basically there is a standardization, and if it is more than 120 by 80, either of it, if it is 121, it is hypertension. If it is 81, it is hypertension. If both are high, like 121, 81, it is a definition of either pre-hypertension or elevated blood pressure. Now, when this gets a pathological number, like 140 by 90, some people in the US, it is 130 by 80, it achieves or crosses another number, it becomes a disease entity that needs to be treated. So in one word, it is a measurable thing measured by a machine, and you get some number that is 120 by 80. There is a gray zone between 120 by 80 to 130 by 80. If you cross 130 by 80, you are hypertensive. Okay, over. Can you move on to the second question or third question?
Yeah.
Over.
Just to know, is there any best diet for high blood pressure?
I think in overall, don't take hypertension as a separate entity. When hypertension comes, it comes with other comorbidities, like there is sometimes diabetes, sometimes you'll end up with a stroke, sometimes you'll end up with hyper uric acid level, high uric acid level, those several things. So when it comes with one disease like simple hypertension, many young people, there are several things can be done in your diet, but most of these dietary restrictions or regulations or advice can be generalized to all of the cardiovascular disease, be it hypertension, be it diabetes, be it stroke, be it heart attack, etc., etc. So there are if I start with salt, then fiber, then your fat, and then several things. So in one word, if it is coming from animal kingdom, like non-vegetarian diet, you should take the fresh meat, not the red meat, no processed meat. It contains high salt. Similarly, fish, all the fish are good. Egg white is good. But you have to remember the calorie content of each meal. So this may be safe, but if your calorie is very high, then you get your obesity, you develop hypertension. Now you say that carbohydrate, specifically carbohydrate without fiber, like raw sugar, eating sweets, is basically due fat. That means you develop diabetes as a consequence of diabetes. If you have hypertension, then you die more frequently. So I would say that there are like fruits and vegetables. There are different oil to be avoided. like trans fats. Trans fats means those are available in chips, potato chips, or very crispy things. Those trans fats should be avoided as minimum as possible. Then saturated fat should be reduced. Protein you can take, but protein is costly. And carbohydrate in poor country like India, carbohydrate is mandatory, but try to reduce carbohydrate as much as possible. High fiber carbohydrates is preferable. All kinds of green vegetables are preferable, and we should say that high potassium diet and low sodium diet. And I'll come to that about salt and other advices. High potassium reduces blood pressure, is beneficial, should be 3.5 gram per day, and salt should be salt. Salt means sodium chloride should be less than 5 gram per day. And if you take sodium, that is around less than 2 gram per day. So 2 into 2.5, that is the salt amount. And except during pregnancy, in pregnancy we need a higher amount of salt, and iodine, calcium, magnesium, these are the other minerals, and especially iodine, our salt is fortified. So little bit of iodized salt, which can prevent thyroid disease. Once you develop thyroid disease, you can develop hypertension. So iodized salt, 5 gram per day, should be the upper limit. And protein, any protein you can take, except in high uric acid, where uric acid, the source is usually animal protein, not the vegetable protein. So dal, cereals, coconut, etc. is not that important in if you have a gout or high uric acid, but mainly it comes from animal proteins like animal, egg yolk, fish, mutton, chicken, etc., etc. Whatever you take, the fat portion of the meat should be removed. So that means you should take the brown portion, and not too much of cooking, and the diet. I think that oil is also very, very important. Less oil or zero oil. Uh, whatever oil you want to take for your cooking is pardonable, advisable, except coconut oil and palm oil. So in summary, whatever is basically healthy for your hypertension is also healthy for other things like diabetes and heart disease. It's a commonality, and it's preferable to take fruits and vegetable and boiled food over.
Queries would have been addressed by that answer. Next question is, what is 120/80 blood pressure is considered normal? And is there any logic behind this 120/80? Is this normal at any age, or does this change?
Okay, that's a very good question. It's like why it is 120/80. It is not arbitrary, but it could be 119 by 79. Fine. Now the heart generates a flow, and there is a resistance in the vessel. So in normal physiological conditions, now if you ask me why human being is 6 feet, why not 10 feet or 20 feet? So that the God or the person who has created us has created in that fashion. It's like our blood pressure according to your heart mass and the number of vessels, the resistance in your body, that physics or that flow dynamics works. And you have a certain area of the valve, like aortic valve area, a certain dimension, it is elliptical or roundish. So all these physiological thing determines what should be the exact number of your flow blood pressure, which is being transmitted laterally on your arterial wall, which can vitalize your vital organs like brain, like kidney, your skin, your muscle, and you will be able to survive with that number. So that is predetermined by your evolution, I would say. So it is different from different animals. Like elephant has a different number, the horses has a different number, human being has a different number, the dog, cats, they have a different number. So 120 number for human is being studied, and we have found that below that, if you go rapidly, it can cause harm, and if it goes above 130/80, it also can cause harm. So 120 to 130 is a gray zone area. Anything beyond that is harmful zone. So that's why 120/80. But this is a science. This is not a like assumption. So there is a huge science between 120/80. It's very difficult to comprehend on Facebook or in common media. But take it for granted that it is scientific. Over.
Some foods be categorized as causing high blood pressure and some foods be categorized as reducing the blood pressure.
Yeah, as I said, the blood pressure thing is due to salt, sodium, and the high salt containing food, especially processed meat, processed food like sheepy they eat, these army people, the soldier they eat, or tinned preservatives. These are actually having very high salt content. Now you can ask me why they don't develop hypertension. Many of them do develop hypertension, but they also jog a lot, they exercise, they are stressed out, so they sweat a lot also. They lose sodium. But anything which contains high sodium, or you put extra salt during preparations, like fruits are good, but there are some fruits Indians or people take with extra salt, like guava or the cucumber. So these are the fruits actually good, but you are taking with salt because of extra pleasure. So anything which there are certain potato chips, it contains high amount of salt. Some mouth-watering beverages can cause high amount of salt and hypertension. Alcohol can cause hypertension. So there are several drugs, several diet which are responsible for high blood pressure. Overall, high potassium, high calcium, but too much of calcium is also not good. High mineral content and low sodium, less than 5 gram of salt, sodium chloride is recommended by WHO, and 3.5 gram of potassium, not potassium chloride, is recommended. The best source of potassium is again fruits and vegetables, not by extra salt. Don't try to take extra salt that is the source of potassium. So if it comes naturally with milk, calcium is good, magnesium is good. Iron is another thing which can help the lady. Iron, as I mentioned, because in the long term, this is very important for the baby's brain development and thyroid development. So it should be a healthy diet which contains the good combinations of all minerals and salts, and it can help blood pressure. But in hypertension is not the only thing in our body. We have certain other comorbidities which can come hand in hand with hypertension. So the diet which is universal for all these metabolic disorders, low calorie, high protein, fat is all right if it is not coming from trans fat, and that can help reducing blood pressure. Over.
Right, doctor. The next question is, does exercise increase blood pressure?
So yes, it has to increase your blood pressure. But if you have a trained one, if you're accustomed to that kind of exercise, the rise or the spike of blood pressure usually goes down. That means you are getting acclimatized. So a marathon runner, if I become a marathon runner tomorrow, my pressure will go up to a high normal. That is not recommended. So if I do exercise gradually, and if I run, if I go for weightlifting, and that is slow and gradual increment, your blood pressure will also get acclimatized. But sudden movement, sudden jog, sudden sprint, sudden exercise, sudden weightlifting, anything which comes all of a sudden can raise your blood pressure, and you can land up with trouble. So over exercise or over jogging, and you want to finish your whole quota in one day, is not recommended and can cause problem. So exercise does increase the blood pressure because that proves that your whole function physiological system is intact. Over.
Moving on to the next question. What is the role of salt in blood pressure and how much of it is exactly allowed?
I think I have mentioned that. I'll be repetitive. 5 gram sodium chloride, 1 TSF, iodine fortified, and potassium salt is not good. Over.
Can high blood pressure be cured? And if not, how can we control it?
Look, it's a chronic thing. It's not that it cannot be controlled. If there is a precipitating factor like high alcohol intake, high rate of smoking, obstructive sleep apnea, snoring, and stressed out, like you're not able to sleep 7 to 8 hours, which is recommended, and you have suffered from some thyroid problem, which is has been removed or been taken care of by medicine or surgery. You have a tumor which has been removed. These secondary blood pressure or coarctation of the aorta, the hypertension is completely cured. But if it is systemic hypertension, you may not take. The doctor may advise you not to take medicines, and you may think it is a kind of cure, but you have to continue low salt, lifestyle modifications, less calorie, the dietary habit, yoga, asana, pranayam, breathing exercise, freehand exercise. All these can cure blood pressure. At least it can keep you within 120/80, but most of the time you can end your life with this kind of advice. But if it goes above certain levels, then you prescribe antihypertensive medicines. There are several varieties are available, all are safe. And some people ask, if I take medicine I become hypertensive. No, it's not that way. You may become hypertensive. You initially take care of your blood pressure first by medicines, and if you are able to quit your smoking, alcohol, that exercise, calorie, etc., we can you can get rid of blood pressure. You can call it as a control, but you will be stamped as hypertensive in our medical practice, because we have separate criteria to call somebody hypertensive or non-hypertensive. And this is not a one-time thing, but it's a dynamic thing. And sometimes we go for counseling, and to tell people, please continue medicines. But there are remedies, as I have mentioned, and certain, I wouldn't prescribe any Ayurvedic medicines or any miraculous drug for you. But there are a lot of possibilities of having this yoga and pranayam to take care of your blood pressure. Over.
Now we move on to the rapid fire section. Are home blood pressure monitors or machines accurate?
I think this is another very important questions. BP machines can give rise to very weird number, can take you in the wrong directions because of not the machine as such. It is the application of the blood pressure cuff, and too tight or too loose. Hearing the sound by the machine may be a faulty one if you are not able to apply those cups properly, because there's a sensor there, audio sensor there, or tactile sensor there in many machines, and it can give rise to. But you have to calibrate that machine with a normal human being time to time, or you can bring it to your physician, local physicians. So those people who are normal in their home, you can get their blood pressure check and get calibrated. Over.
And how to lower blood pressure immediately?
If it is stress related or is related to your kind of social disharmony, you just cool down. If it is not, then if your BP is very high and if you are symptomatic, then please go to your doctor. Don't. Yoga, asana, yes, definitely helps.
And doctor, what is an average BP or blood pressure by age?
Look, when we are student, and then we just learn that normal BP for anybody will be 120 plus age. That concept is wrong. And anybody, any age, if it is more than 130 upper, more than 90 lower, more than 180 in some situations, especially during pregnancy, is definitely abnormal, has to be treated. Now, the goal of lowering blood pressure may be different from age to age. Younger patients should have almost a normal blood pressure, like 120 by 80, without any symptom. But elderly people can be a little bit, there can be a little bit of relaxation. I would say like 150 by 90 is all right for 80 years old, 85 years old male who is frail. But if somebody is healthy and very strong enough, walking, talking, jogging, running, even him 120 by 80 is not harmful if he's not having giddiness, having fall, and symptomatic because of blood pressure medicine. So high normal, normal, uncontrolled, these are all medical terms, but it varies from person to person. Over.
And doctor, how often should I check my blood pressure if I have hypertension?
I think usually in the first few months when you are just becoming hypertensive, every month you should check, every week you should check. But once your BP is stabilized, then go by a doctor's advice. If you have some additional issues like if you have stent, angioplasty, you had a stroke in the past, you have heart failure, then frequently should be checked. If you had symptoms due to high blood pressure or low blood pressure, the fragile blood pressure or fluctuating blood pressure, it should be measured frequently. Ideally, I'd say in the first year, maybe every month. After 1 year, every 2, 3 months. After 3, 4 years, every 4, 6 months is all right.
And does lying down actually reduce the blood pressure?
Like um, like your septic shock or when you're standing, you had a lot of sympathetic overdrive, but those sympathetic overdrive is relieved when you're lying down. But it's other way around. Like you, if you stand up, your blood pressure goes down. If you lie down, blood pressure goes up. Or somebody who is having symptom due to low blood pressure, we ask them to lie down because even at 70, 80, at least that is a sufficient head of blood pressure which can take care of your brain and the kidneys to sustain life. So as long as you are lying down, your blood flow to the vital organ is maintained. Don't try to get up because you may feel giddy again, you have a fall. So very few conditions your blood pressure can go low on lying down, but in majority 99% cases it is the reverse.
A very relevant question. Does walking actually decrease blood pressure?
Yes, regular walking, regular exercise does decrease the blood pressure, and that is regular exercise. As I mentioned, accustomed exercise, walking, jogging, marathon runner, and good training. So definitely walking is the best way of exercising and does reduce blood pressure.
Question,
Can you
sir.
move to this? Yeah.
Yeah. Also, doctor, how best can one control hypertension or blood pressure without medication?
That's a great question. Like there are several ways of doing that. Once you know what causes hypertension, then you can go for what are the remedies of hypertension. Most of the time, it is genetic, and most of the time, some member of the family is hypertensive. So it's a kind of carried away thing from one member of the family to other members of the family. But there are certain things which can precipitate or the onset that somebody you are supposed to, like somebody who has a hypertension in the family, if he's supposed to develop hypertension at the age of 50, now if he indulges on certain things like smoking, that can predate the hypertension. These are called precipitating factors. So there are several things in 2020. There are some modern risk factors or modern causations, like if I say with like any anxiety, lack of sleep, snoring, obesity, like heavy alcohol, some drugs, heroin, addictions, stress, loneliness. These are the precipitating factors. But air pollution, sound I have mentioned, Beside that, if you have something called secondary hypertension, that means your organ, like if you have some developmental problem in your circulatory system, is something is narrowed, like coarctation of the aorta, or you have some tumors, or during pregnancy, it is called preeclampsia, or in childhood you have some kidney disease or some hormone related disorders like thyroid or your adrenal gland, we say. So these are several things which are one of the causative factors. These are called secondary, but majority, once you exclude those, majority are primary hypertension. That means we still do not know the exact cause of hypertension. There are several theories, something like genetic, something like what your bacteria in your stomach. So more and more, there are newer theories may come from your bone marrow, may come from your epigenetic mechanism, like your gene changes with the environment, as I said, like air pollution. Several theories are coming, but in nutshell, most of the time we do not know, and many times we know, and these are called precipitating factors or secondary hypertension.
Thank you, Dr. Hazra, for your valuable time and quite an informative session. Thank you, viewers, for joining us, and I'm sure this session has answered a lot of questions about blood pressure and its control. Thank you and take care.
It was perhaps very simple, but I think it is more informative than going into the depth of medical thing. And hope to see you again with more and newer things. And thank you. Bye. Good night.